Welcome back to Rural Health News, this segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent? Let's take a quick look at rural health projections for 2026 from the Chartis Center for Rural Health. According to Chartis, more than 40% of all rural hospitals operate in the red. Since 2010, 200 rural hospitals have closed or converted to outpatient-only care models. This year, more than 400 rural hospitals are at risk of closing, and more than 300 have already eliminated OB and general surgery. Behavioral health is also suffering under the national strain, with almost 90% of rural census tracts designated as healthcare professional shortage areas for behavioral health professionals. This report emphasizes the urgency of rural health care needs for a better federal and state support. That starts with hospitals, communities, and individuals voicing their concern for the state of rural health and advocating for local access to care. On to the damage report. Today, I'd like to give you an update on some of the most urgent news headlines that we've reported over the past few months. Last week, Stryker reported in recent cyber attacks, as we explained on our podcast, that there has been a contained environment that they are working to restore the affected systems, primarily ordering and shipping. The American Hospital Association has led efforts to implement cyber security measures to protect hospitals and ensure that the industry supply chain is not disturbed. John Regi, a friend and former podcast guest on Rural Health Today, is at the heart of these efforts and continues to monitor every aspect of this situation. Patients enrolled in the ACA health plans are now worried about their rising premiums, and more are planning to drop their coverage if premiums remain this high for the rest of the year. The congressional blockage of enhanced premium subsidies put tax credits out of reach for a significant number of ACA enrollees, making healthcare less accessible and communities more vulnerable. Most recently, a poll reflected that half of those who re-enrolled in their plans say their healthcare costs are a lot higher this year. Many worry about out-of-pocket expenses, and 55% of re-enrollees say that they are or will be cutting back on expenses for such things as food and basic housing items to help cover these healthcare costs. That number is higher for patients with chronic health conditions, with 62% reporting a strain on their household budgets. Several weeks ago, we reported an uptick in measles cases since the beginning of the year, and sadly, it's only gotten worse. As of March 12th, the CDC had confirmed 1,362 measles cases located in 31 jurisdictions. 94% of these cases are associated with outbreaks, and 14 outbreaks have been reported from this year alone. Comparing this to the total 16 outbreaks reported in 2024 makes the sharp rise in cases clear. We encourage every community to respond with appropriate measures and follow the CDC guidelines to reduce this rate of outbreaks and protect our most vulnerable populations. For a full report of these items, explore our Rural Health News backlog at ruralhealthtoday.com or wherever you get your podcast. And now for today's success story. Thanks to the 340B drug pricing program, Michigan's Mackinac Straits health system was able to open a retail pharmacy right in St. Ignace, Michigan. This is great news because St. Ignace, small community in Michigan's Upper Peninsula community, once did not have a pharmaceutical service on weekends and holidays, forcing residents to travel 60 to 100 miles round trip for their emergency medicines. Mackinac Straits Retail Pharmacy has been a major success so far, filling over 56,000 prescriptions annually. Well done to my good friend Karen Cheeseman, President and Chief Executive Officer, and her leadership team over at Mackinac Straits Health System for the work they have done and continue to do to improve healthcare access in the Upper Peninsula. Thank you to our sources for this episode: KFF Health News, the Chartis Center for Rural Health, Reuters, Chief Healthcare Executive, CDC, and the Michigan Health and Hospital Association.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.